The question is which healthcare bill in Congress will do the best job of reforming our American healthcare system. And this means not only a bill that can pass Congress, but also one that gives every patient and every future patient confidence in their doctor and in the system. There's one bill that can cover everybody, all 46 million uninsured. That's completely bipartisan. And that's from the beginning, not as a few add-on senators from Maine. No tax increase at all. It's already drafted, introduced, and scored by the Congressional Budget Office, and it fits all of President Obama's 8 principles. And it's the only bill so far that fits all 8 principles. What's not to like about this approach? And there are 3 key principles in the bill. First of all, everyone could shop for health insurance just like federal employees have done for 40 years. Now this does not affect anybody's Medicare or TRICARE or VA benefits, so it does not affect our seniors or military, but it rearranges much of the rest of the healthcare system. Second, the insurance relationship between bosses and workers, employers and employees is modernized. Your employer will still contribute, can offer their own coverage. Union contracts would stay in put for at least 9 years. And the third key point is this: poor people are mainstreamed into private health insurance. So there would be subsidies for folks up to 400% of poverty, much more generous than today's Medicaid program. And Medicaid would essentially become a wraparound benefit. The secret to all this, what bill could accomplish all this? Well, an economist would tell you it's informed cost-conscious choice. We would say it's really about coverage. The coverage principle is key. We use an umbrella metaphor to describe it. If you're self-employed or a small company, you might get an umbrella or 2. If you're a large company, like say IBM, might have a nice tent. We think that's not good enough. A better approach is in the Healthy Americans Act, you'd get an indoor arena, a roof over everybody's head, everybody gets a seat. Now this is based on sound economics. This would be large risk pools by state or region. So this would allow risk spreading among hundreds of thousands, millions of people, far larger than any usual employer group. It's not single payer. President Obama did not campaign on that, and it probably can't pass Congress. What we use is competition among private regional players. These private companies are forced to compete in a completely new way than they've ever competed before. They would compete to offer, keep you healthy, not to drop you from coverage. Basically, they'd have to invite everybody to this party, and the companies would have to wait on you hand and foot. All the big names: Humana, Blue Cross, United, Aetna, etc. The idea is that everybody would be able to pick from a dinner menu of insurance options, and these would be complete dinners. It'd be something like Blue Cross standard option coverage, real health insurance, and everybody would get actually more choices than they have today. Everybody in every region would get at least 3 choices. One would have to be a deluxe option. HSA options are also allowed, so there's more choice, more freedom. And there is one key principle here, though. If you want sirloin steak or some deluxe benefit, that incremental extra cost you'd be responsible for. So this is the idea, is to make sure that at least everybody gets good coverage first before anybody gets deluxe steak. In insurance company jargon, it means banning the skimming of the cream, because so many insurance companies today, they don't want to serve everybody. They only want healthy young people. And as soon as you get sick or injured, they drop you like a hot rock. So in insurance company jargon, there'd be no more pre-existing condition exclusions, no genetic discrimination. There'd be guaranteed renewability and basically modified community rated premiums. There's a ton of wellness and prevention in this approach. That's a major focus, but actually it's not scored in the bill. So the cost savings in the bill do not include this. I think when these savings pan out, it's going to make the bill even more cost effective. So how does all this approach work? Where's the beef? It works like this. Today, in today's insurance system, if you have one of these insurance cards, you can get in the door of your doctor's office, and it's better than a credit card, because for this insurance card, on average, you only have to pay about 1/4 of the cost. So that's a great deal. But remember, it's all about coverage. Almost 50 million Americans don't have one of those cards. So how do we cover everybody? Individual coverage doesn't work very well, and no, I did not doctor that picture. Small group coverage doesn't work much better. Most small businesses only have 5, 10, 15, 20 employees. That's a tent that doesn't keep you very dry. The better approach is the Wyden-Bennett sort of arena, the Healthy Americans Act sort of arena, so that everybody in the region, everybody in the state has a seat, has a place. Now, the big question is who really pays for health insurance? A lot of folks get confused about this. Our entire employer-based system is a result of a historical accident in 1942. As a result of wage and price controls back then and all these unintended side effects. What we did was put a lid on wages and prices. Fringe benefits overflowed from the pot, and those fringe benefits have gracefully grown like kudzu. The result of all this is that median cash wages in America have flatlined for decades. People are not making more cash money. Now they're being more productive and stock prices until recently have gone up, but workers are not benefiting. What's wrong here? Well, workers have been getting more in fringe benefits, but these fringe benefits sometimes haven't been worth much. So it's really like the healthcare sector using a vacuum cleaner to suck up all your pay raises over all these years. If I were to offer to confiscate everyone's pay raise in America for the next 40 years for my worthy cause, perhaps education or defense or things like that, people would say I was crazy. But healthcare has been doing this to us for 40 years. The result of this has been a trajectory of health spending in America that's almost more than we can afford. So all the Wyden-Bennett Healthy Americans Act would do is reduce that by less than 1% a year. Health would continue to grow. Nobody's cutting back on anything, but we would grow a little bit more slowly. Well, just reducing by less than 1% a year would save $1.5 trillion over a 10-year period. Now, there are three things that don't exist. There are three figments of your imagination: the Tooth Fairy, the Easter Bunny, and Boss Claus. I invented Boss Claus, so I'm happy about that. There is really no such thing as employer-paid health insurance. The boss wants to get credit for contributing to your health benefits, but he's really taking that out of your foregone pay raises. Now, the boss does get to pick the insurance policy. That means there is employer-sponsored coverage, but the boss is picking, you are paying, the worker is paying. So really, there's no such thing as employer-paid health coverage. What the Healthy Americans Act would do would take your current fringe benefit, turn that into cash so that every worker in America would get a cash pay raise, and then you'd pick your own health benefits. You would be in charge, so you'd have the same amount of money as you used to have, only this time you get to pick the health benefits. And it's not in today's crummy individual or small group insurance market. It's in a new, completely reformed health market like federal employees have been benefiting from for decades. Another thing about worker-sponsored coverage is that it's not really that private. Your boss knows more about you than he or she should. You don't want your boss to know, for example, whether you've got diabetes or not. Not many workers realize that the boss has the right to read your email at work. So we think health insurance should be more private. Also, we think that too many Americans are chained to their job due to fringe benefits. We think that it's much better to have portable benefits. And Wyden-Bennett, the Healthy Americans Act, would take the fixed wardrobe of benefits and enable it to be portable. Essentially give you a new set of luggage so you can take your health care insurance wherever you choose to live and work. So there's a downside to everything. The most critical things you can say about Wyden-Bennett are these. It does reduce the role of employers in health care. It does not eliminate that, and any company that wants to keep their benefit system can do so. It makes employee payments more obvious, and we think that's probably a good thing because it leads to better shopping and sound economics. Today, workers only see the full cost when they lose everything they've got. When they lose their job, then they're on COBRA and they think it's unaffordable. This bill does contain individual and employer mandates. A lot of folks don't like to be told what to do. We don't like it either, but like with uninsured motorists, every car on the highway needs to have insurance. Every individual is going to get sick sooner than they realize it. We need to go ahead and get them signed up with the coverage. It does start limiting the huge hidden tax breaks that are in today's system. These are $200 billion plus a year, and would gradually limit the growth of those tax breaks to the growth of inflation, not inflation plus 2.5%. So we think this is a good step toward gradually reining in health expenses. No cuts, but gradually reining in the growth of health care. Finally, it takes everyone off of Medicaid except for the wraparound population. A lot of folks are worried about this because sometimes they prefer the devil they know versus the new idea. We think it will do two super important things for poor people. Number one, more people can be covered up to 400% of poverty. That is much more generous than most states. And second, poor people would have much more doctor choice because almost 2/3 of doctors today will not see a Medicaid patient if they can help it. Give an example of doctor choice. Today, the Medicaid selection is somewhat limited. Only a few doctors will see a Medicaid patient. But if you have the Healthy Americans Act, you get much broader doctor selection. So what does all this look like? It's bipartisan. And that's an ugly beast, but it will work and work well. In the Senate, the bill has 14 co-sponsors, 8 Democrats and 6 Republicans. We think that when you're passing fundamental change, it's important that it be bipartisan. It's particularly important with health care because when you're sick, the last thing you want to think about is politics. And when you're sick, you have to have confidence in the system. You have to have confidence, most of all, in your doctor, the doctor that you have chosen in a free market. So we think this is an important contribution to the health reform debate. It's not the be-all and end-all. Certainly it needs a lot of amendments, but it's a great starting point. It pays for itself. It's completely bipartisan. It meets all of President Obama's 8 principles, and it's the only bill so far to do so. And time is wasting. Every second, every day we wait, every tick of the clock, we lose a chance to fundamentally reform health care insurance in our country.